Many people who live with pain undergo all types of pain management therapies, including prescription opioid pain medication. While opioids are an important part of the treatment that people living with pain, life-threatening side effects can occur. So here to help us learn more about safeguarding against opioid emergencies and also a new campaign is Penny Cowan. She is founder and CEO of the American Chronic Pain Association. And then also Dr. Gupta, Anita Gupta. Good morning to you both. Great to have you on.
Good morning, Stephanie.
Dr. Gupta, what part do opioids play in the treatment of people living with pain?
Opiates is one of many medications and options for treating chronic pain. And anyone on these medications really needs to have a conversation with their doctor on how to take them safely and also prevent potential life-threatening consequences. And that's what we're here to talk to you about today, is some of those options. There's a medication known as naloxone that may prevent some of these opioid overdoses. Oftentimes it can be unintentional.
I know, Penny, you are living with pain like this. What do people living with pain feel, or what do they go through?
Yeah, they go through a wealth of emotions, and pain really sort of takes control of their lives, and everything is filtered through their pain. And so it's really important for people to be an active participant in their health care and to look at themselves as part of the treatment team, that they have to have an open dialogue with their health care providers. And if they go to americastartstalking.com, they can begin to learn exactly how to have that discussion in case they're taking an opioid, a prescription opioid, and if something should happen. You know, there are 44 people die every day from opioid prescription overdoses, and 80% of those are unintentional. So it's really important for people to understand what do they need to do. And as Dr. Gupta said, you know, it's that naloxone that they need. So they need to have a conversation with their healthcare provider, but they also need to have a conversation with their family and their friends, because a lot of times, you know, it can happen anywhere, anytime, to anyone. So they need to know, how do you respond to that kind of emergency? There's a great video on that website. There's a wealth of resources. It's, you know, it's a coalition of 5 organizations. It's supported by Kaleo, and it's important for people to understand. So americastartstalking.com is really the place to start.
Yeah, certainly. What a great resource. Dr. Gupta, what are the potential side effects that people taking opioids should be aware of? What do we really need to be looking for?
Sure. I mean, first, you know, and foremost, opioid emergencies can happen to anyone, anytime, anywhere. But some of the most common life-threatening signs and symptoms that can occur are very critical to identify. One and the most common and most serious is slowed breathing and absent breathing. You know, loss of consciousness. These could be critical signs of an opioid overdose that might require rapid treatment with a medication, again, known as naloxone.
What can caregivers and maybe the patients do to be prepared in the case of an opioid emergency? What can we do to help? Maybe a friend or family member.
One, you know, talk to your doctor. Ask them the questions. Ask them about naloxone and see if they're an appropriate candidate for that medication. Two, you know, understand diseases and conditions that can affect how these medications work. Be comfortable taking these medications and identifying drug interactions that may also potentially cause some of these unintentional deaths. You know, visiting America Starts Talking is the first step in beginning the process and starting those hard conversations that sometimes are uncomfortable to have.
Yeah, and I think for family members, you know, it's important that they understand what should they do. And again, that's why there's the discussion guide for the family and the friends, so that they understand, because they really share. I mean, when one person lives with pain, the whole family can suffer. So they really need to become part of the treatment team, and they need to understand what it is they have to do. And that's where America Starts Talking. That's really where they can begin that conversation, understanding what they need to do.
Certainly. And then as we close here one more time, tell us, you know, how we can begin that conversation and where we can go online to learn more about this, because as you said, it is the first step.
AmericaStartsTalking.com is the best resource that's been developed by a coalition of several advocacy and professional organizations to help patients, physicians, family members, friends to begin that conversation and understand some of the ways to prevent some of these overdoses.
Ladies, thank you so much. We certainly appreciate you taking the time to share this with us and talk to us today. We're going to have more on this segment posted online, and all you got to do to get there is go to fox4morningblend.com.